Hello everyone and welcome to our presentation on NCCI Basics for Therapy Practices. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance education and consulting firm specializing in physical, occupational, and speech therapy. We offer regularly scheduled live, full-length continuing education courses, and we have a large library of recorded compliance and clinical courses. The website contains guides, sample forms, and policies on Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws. We are working on PT, OT, and SLP compliance guides for all 50 states, along with therapy-related information on Medicaid, workers' compensation, home health, facilities, early intervention, school-based services, and other relevant state laws. We offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. We also offer credentialing services, claims appeals, and billing support, compliance audits, and more. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The first NCCI edits are the procedure-to-procedure edits, or PTP edits. The purpose of the PTP edits is to prevent improper payment when incorrect code combinations are reported. The NCCI contains one table of edits for physicians / practitioners and one table of edits for outpatient hospital services. PTP practitioners. This PTP code pair edits are applied to claims submitted by physicians, non-physician practitioners, and ambulatory surgery centers. This is also going to be, if you're a therapy practice, a PT, OT, SLP practice that's not attached to any sort of facility, but you're on your own, or employees of a physician group, these code edits are going to apply to you. PTP hospital edits are applied to outpatient hospital services and other facility services, including therapy providers that work in Part B skilled nursing facilities, comprehensive outpatient rehab facilities, outpatient physical therapy and speech language pathology providers, rehab clinics, and certain claims for home health agencies. So the basics of PTP edits. You have two columns, column 1 and column 2, and they're comprised of PTP code pairs. If a provider submits the two codes of an edit pair for payment for the same beneficiary on the same date of service, the column 1 code is eligible for payment and the column 2 code is denied. If both codes are clinically appropriate and appropriate NCCI associated modifiers used, the codes in both columns are eligible for payment. Supporting documentation must be in the beneficiary's medical record. So this is how the PTP edits look in an Excel file, and it's a very large file. So the first table here is you have the codes. These codes can be, it doesn't matter if they're billed one before the other or the vice versa. If they're billed together, one will be denied, usually the second one. This next one is the date it was implemented. If there's a star here, it means that the code pair is still valid. If there's a date here, that means it's been ended. The 1 here means that you can use a modifier. The 0 means you cannot use a modifier. And the 9 means, again, that it is no longer valid. And the last one is the reason for why there's an PTP code pair there. So just a recap of what I said, column 1 indicates the payable code. Column 2 contains the code that is not payable with the particular column 1 code unless a modifier is permitted and submitted. This third column indicates if the edit was in existence prior to 1996. The fourth column indicates the effective date of the edit. The fifth column indicates the deletion date, if applicable. The sixth column indicates if use of a modifier is permitted, the number of modifier indicator for the edit, and the seventh column provides the underlying basis for the PTP edit. So again, the 019 indicates if you can use the modifier 59 or the X modifiers. If you have a 0 there, it means you cannot use a modifier no matter what, and the in use will not bypass the edit. 1 means you can use it, so if you use it correctly, you can bypass the edit. And the 9 means the modifier is not specified, and this usually means that the NCCI PTP code pair has been deleted, so it really doesn't matter. So now I'm going to go through the rules that apply to therapy practices. So this one is for evaluations. An OT may report only one evaluation or reevaluation on a single date of service. A PT may report only one evaluation or reevaluation on a single date of service. A group or facility cannot report both an OT evaluation and a PT evaluation service if performed by the same practitioner. If the two services are performed by two different practitioners on the same data service, both procedures may be reported with use of either modifier 59 or XP. So these are the PTP edits for 97161, the PT evaluation, low complexity. You'll see there are many codes here. The top codes here are allowed with the modifier. The ones bottom are not allowed. So you'll see on the bottom here, the ones that are important, the reevaluation code, and a number of different assessment codes. And that's basically how it works. There's usually no problem if you do treatment after an evaluation, as long as the treatment was done after an evaluation. But as long as the NCCI edits are concerned, it really will only block a reevaluation on the same day or another assessment code that's similar to an evaluation. On my website, Therapy Comply, I have every single code laid out like this for therapy services, PT, OT, and SLP. The same thing goes for an OT evaluation. Again, you'll see at the bottom here you have a reevaluation, and also you'll have assessment codes as well that you cannot bill for on the same day as an OT evaluation, even if you use a modifier. So now for reevaluations. Reevaluation services shall not be routinely reported during a planned course of physical or occupational therapy. This is very important. Under the Medicare rules, you do not bill routinely for a reevaluation. You don't bill one every 30 days, 60 days, 90 days, or on every progress report. You only bill when the client's condition has significantly changed. For the rule here, if the patient status should change and reevaluation is medically reasonable and necessary, it may be reported with modifier 59 or XU appended to the code, and I'll show you why. So as you see here, again, like the evaluations, you only have a few assessment codes here in the not allowed. The allowed with modifier, most of those aren't therapy codes anyway, so it really doesn't matter. You're really only blocked here with these assessment codes. You see here with mechanical traction 97012, and this applies to a lot of other modalities. If you bill for that modality and you do a reevaluation on the same day, either before or after, you're going to have to use a modifier, so either 59 or XU. The same goes with electrical stimulation 97032. Again, if you do a reevaluation on that day and bill for electrical stimulation, you're going to have to use a modifier if you don't want one of the others to be rejected. So now for assessments. Like I showed before with the evaluations, you won't be able to bill an assessment with the evaluation or a reevaluation. And by assessment, we're mostly just talking about 97750, physical performance test or measurement, 97755, assistive technology assessment, and 97763, orthotic prosthetic management and training. So assessment codes are not separately reportable for the same data service with a PT eval or reevaluation or an OT evaluation or reevaluation when they're performed by a single practitioner or two practitioners of the same specialty. If two services are performed by two different practitioners of different specialties, the two services may be reported using an NCCI PTP associated modifier, so that's either 59 or XP. For example, if a physical therapist performs one service and an occupational therapist performs the other services, the two services may be reported separately. However, if it's a PT and another PT or an OT and another OT, you can't report. So again, just showing here the PT evaluation. Again, you have those assessment codes down here with the not allowed, so you can't bill them on the same day. Now for orthotics and prosthetics. 97760, orthotics management and training, and then 97761, prosthetics training. O&P codes are not separately reportable for the same data service with a physical therapy reevaluation or an OT reevaluation when the two services are performed by a single practitioner or two practitioners of the same specialties. If the two services are performed by two different practitioners of the different specialties, the two services may be reported using a modifier. So again, just showing the code 97760 allowed with modifier, the two reevaluation codes. Again, so that would be modifier XP or 59. And just the same thing with 97761 prosthetic management. Now with group therapy, 97150, there's going to be a number of codes during the therapeutic procedures, mostly that you're not going to be able to bill on the same day with group therapy without a modifier, and even some with a modifier. So you just want to double check these codes here when you're doing group therapy. Make sure you're in the right category, allowed with modifier, then use the modifier. If not allowed, you can't do it at all. So you may want to just double check when you're doing group therapy. Look at the NCCI codes for that to make sure you're not billing two codes that can't be billed on the same day. So modifier 59, this means there's a distinct procedural service. Under certain circumstances, it may be necessary to indicate that a procedure or service was distinct or independent from the other non-EM service performed on the same day. Modifier 59 is used to identify procedures and services other than EM services that are not normally reported together but are appropriate under the circumstances. Documentation must support a different session, different procedure or surgery, different site or organ system, separate incision-excision, separate lesion or separate injury, also a separate practitioner for those two codes. Only if there's no more descriptive modifiers available, then use a modifier 59. So these are the more appropriate modifiers, XE, XS, XP, and XU. Most payers will allow you to use either 59 or these codes. There really is no hard, fast rule yet on just using these codes. Using the X codes can help you in some cases because they're more specific. So XE is separate encounter. This means a service that is distinct because it occurred during a separate encounter. The modifier should only be used to describe separate encounters on the same date of service. XS is separate structure, so a service that is distinct because it was performed on a separate organ or structure, body structure. So now XP and XU, so these are the ones you're going to actually use the most for those therapy NCCI edits, because you saw you really don't have any procedure to procedure for regular therapeutic procedures or modalities and other therapeutic procedures and modalities now anymore. It really just is about those evaluations, the assessments, the reevaluations. So XP is that separate practitioner. So if you had a PT do one service and OT do another service on that same day, and then XU is the unusual non-overlapping. This is when you're going to have that reevaluation and a modality that you're going to bill on the same day. You're going to want to use XU if you can. So just now a recap, modifier 59 is used appropriately for different anatomic sites during the same encounter, or XS. Modifier 59 is used appropriately when the procedures are performed in different encounters on the same day, or XE. Modifier 59 is appropriately for two services described by time codes provided during the same encounter only when they're performed sequentially, XE. This used to be a bigger deal before 2020 for therapy services, but no longer is. Modifier 59 is used appropriately for a diagnostic procedure, which precedes a therapeutic procedure only when the diagnostic procedure is the basis for performing the therapeutic procedure, or XU. And modifier 59 is used appropriately for a diagnostic procedure which occurs subsequent to a completed therapeutic procedure only when the diagnostic procedure is not a common, expected, or necessary follow-up to the therapeutic procedure. And again, XU is the more appropriate modifier now. So real simply, medically unlikely edits are just the maximum units of service that a provider would report under most circumstances for a single beneficiary on a single date of service. That's basically all. So an MUE for a CPT code is the maximum units of service that a provider would report under most circumstances for a single beneficiary on a single date of service. MUE values are not utilization guidelines and do not represent utilization that may be reported without concern about medical review. Providers should continue to only report services that are medically and reasonably necessary. Providers may be subject to medical review of their claims even if they report units of service less or equal to the MUE value for a code. So So this is basically how the MUE edits look. You'll have the code, the description, and then the middle one is the number of units that you can bill in a day. So you'll see therapeutic exercises 6, neuromuscular re-education 4, aquatic therapy 6, and then you have these 3 and 2s. The 3 means you can use you can appeal a denial if you go over, and the 2 means you cannot appeal a denial. That usually means something like therapeutic interventions. Also, evaluations are also 2. You wouldn't be able to bill more than 1 no matter what. But if you had the 3 there, you can bill over, though you most likely will not succeed on that appeal. So just to recap, the first column indicates a code. The second column indicates the maximum units of service that a practitioner would report under most circumstances for a single beneficiary on a single date of service. The third column was that adjudication indicator. Again, a 3 means you can appeal, a 2 means you cannot appeal. And the fourth column is the MUE rationale that provides the underlying basis for each one of those edits. So thank you for joining this presentation. On Therapy Comply, we have a whole NCCI edits page, which goes into more description and also for every code. So we have every PTP code for both practitioner and hospital edits, and we also have all the MUE edits for both practitioner and hospital. So please, if you're a member, please check that out. If you're not a member, please consider joining, and you'll have access to all that information along with a lot of others. So if you liked the presentation today, please like and subscribe, and we'll be adding a lot more in the future. Thank you.